Hi, I'm Dr. Stephen Thaxter, and I'm from Sierra Pacific Orthopedic Center. I've been asked to demonstrate for you hand scrubbing using the principles that we use as surgeons every day before we scrub for cases. So the basic principle is that we want to be thorough and systematic, and this usually involves time or a stroke count, and I'm going to demonstrate for you a basic stroke count that we use in a systematic way to go through your hands and your forearms to wash and scrub. The first thing you need to do is make sure you remove any articles of rings and watches, jewelry, because those are hiding bacteria. And then the second is to make sure that you have your towel, whatever clean towel you're going to use before you get started. You don't want to have to go looking for that after you have clean hands. And so I'll start the water. Ideally, you'd have the water running the whole time. And then I just do a little pre-rinsing just to get water on there to help the lather. And then you'll just put the soap on your hand. You'll try to put enough for both hands that you are able to do the entire wash without having to hit the soap again. So then I just spread it around generally, and then I get systematic with it. And basically there's 4 surfaces to your hands and your fingers, and so you want to go through each of those surfaces with 10 strokes. Now in surgery we have scrub brushes that help us to clean the fingernails and to scrub our hands, but we're just going to use the palm of our hand or our fingertips to be our scrub brush. So starting with my left hand, I'll start with this surface and I'll just scrub or clean this whole surface with 10 strokes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I'm going to go on the back and do the same thing. So we'll do 10 there. And then there's the 2 other surfaces on each side of the fingers all the way through. And so we'll start here at the thumb. And again, you'll do 10 strokes. 1, 2, 3, all the way down to the wrist. 4, 5, 6, 7, 8, 9, 10. And then just keep going through the fingers. I just like to go on each surface, the same surface all the way through, and then work my way back. So that'd be 10 strokes there, 10 strokes there, 10 strokes there, 10 there, and then coming back. And then after we're done with that hand, normally in surgical scrub, we also have a brush to clean our fingernails. Since we won't use that here, I'll just show you that what we can do to really get in there to get the cuticles clean and rid of the bacteria is just to kind of wring the end of each finger like you're wringing a rag or something and just twisting it, just to really work the soap down into the cuticle and into the fingernail. And then the same thing on the other hand. So we'll just do the same thing on the other hand. The 10 strokes for each of the 4 surfaces, and then finish by working on the fingernails like that. And then in a surgical scrub, we'll also go all the way up to the elbow or just beyond. We won't do that here, but it's probably a good idea to at least get the far third of your forearm. And so same thing, it's just 4 surfaces. You start with this surface 10 times, this surface 10 times, and so on, so that you get each surface on each side. When you're all done then, for the rinse, we always want to just do one rinse through the water without going back and forth. And we want the water to drain down from the clean area all the way down to the unclean area. So you can just see I start with my fingertips together, just get the full rinse going and bring up through. In this case, kind of tilting and getting my elbow down into the sink so that all the drainage is going downward. And then the same thing for here. This is the part that gets a little messy, but it's worth it if you want to do a good hand-on scrub. And then coming up, and then you grab your clean towel that you put aside before. And you always start from the clean area and work your way down to the non-clean area to finish. And that's the demonstration of how to use the principles that surgeons use for scrubbing your hands at home.